and girls, welcome back to my channel. I do hope you're doing well. Guys, we're back in the bathroom because it's cold and we've got the heating on, so I'm making full use of it. And I thought, you know what? This actually could be a video that could be done in the bathroom. So a lot of you guys, if you are aware, apologies, the hair is like a little bit everywhere at the moment. We have been going on a teeth journey. I have just gone and had my 6-week checkup. And I thought, you know what, there's a lot of you guys that have been asking, how have my teeth been doing, the gum journey, everything like that. So I thought, I'll sit down and I'll try and get a big selection of questions. I'll tell you my process. And it's basically if any of you guys have receding gums, partial gum disease, sensitive gums, anything like that. I have been on a journey with my teeth for quite a while, and I noticed last year, I don't know what happened. I don't know. A lot of you guys said it could have been the peel. My gums just really started to recede, and I noticed my gums were slightly feeling like looser, and I was like, no, I need to get this sorted. So you guys know me, I don't like the dentist. I really, really don't like the dentist. And a lot of you were saying, Shan, you have nice teeth. And I'm like, from here, they might look okay. Up close, oh my goodness, they did not look okay. They did not look okay. So I thought, you know what, I've had my 6-week checkup. I know a little bit now of where I've got to go down the road for the next year. And I thought a lot of you guys have been asking. So get comfy, get cozy. I would say get snacking, but we need to keep these old teeth polished and clean. And I'm going to talk about, I'm going to call it like my periodontal gum journey, because I was borderline gum disease. I had receding gums. It's a periodontal gum journey. So I have got my trusty iPad to make sure I give you all of the facts. As I say, I am filming this on the 14th of November 2023. So prices may change from this date, but this is what I paid and my consultations and everything from when I started. So I went in for an initial periodontal assessment. I want to get all of the like proper terms for you guys. I went in on the 15th of July, and if you know me, they wanted to do it before my holiday, and I said I cannot be on holiday in pain worrying about what I'm eating when I know I want a lot of food. Okay, the holiday is food for me. So we decided that I would go back middle of September after my holidays. So I went for my initial consultation on the 15th of July, and I went to a clinic called Smile Clinic, and I went to the St John's Wood branch, which is kind of just off of Abbey Road. If you know London area at all, it's just off one of the side streets. The first consultation, guys, I was in pain. It was £175, and I think I was in there for just over an hour. But that included everything. When I tell you I was prodded and poked, it weren't pleasant. For someone who doesn't like the dentist and has a phobia of needles in terms of when it comes to like taking blood and dentists like that, put a piercing or a tattoo on me, I'm fine. But when it's medical, I don't like needles. And it was painful, I'm not gonna lie. I come out and my whole mouth was just numb. I was absolutely like, meh. So in my periodontal consultation, I had x-rays done, I had photos done, and God, the photos are just something else. I'm gonna see, I think I still have the photos on here, but it really gives you a look at your teeth on different angles. I had like a Vaseline clips, and you have these big stretchers, and you tilt the camera up and down. Like, the camera was fabulous. I did say to her, like, I love the lens on that camera. So you have to try and laugh after having, I think it was like 26 needle points in my mouth. So, yes. And the needles don't just stop there. When I actually had the work done, I'll tell you that that's a whole nother story, my lovelies. So I had my consultation report, which I think I will show you the photos and x-rays at the end, because it'll be good to do a comparison. But the reason for attendance was a periodontal assessment, because I said gum disease runs in my family, so it was kind of inevitable I was going to get it. I'm afraid. So the diagnosis was generalized gingivitis. So gingivitis is the stage before gum disease, if I remember correctly. There's like different layers, not layers, like stages. But I did feel that there was points where I knew they was receding a bit more and probably needed a good cleaning, you know. localized, mild and localized, moderate chronic periodontitis. So that was on some parts I did have gum disease, and I knew that especially for like my front part. Stage 3 and grade A, currently active, and the contraceptive pill might negatively be affecting the progression of the disease. So she asked me my medication, and I said I'm on the contraceptive pill, and she said, darling, she said that actually can affect your gums. And it's not since we've done the contraception conspiracies, guys, I've actually really been thinking and reading the book how much the pill can actually affect everything. So for her to say that is, I was like, okay. I had primary occlusal trauma and secondary occlusal trauma due to clenching. I have a tendency in my sleep to clench, and I also clench when I'm angry. If I'm angry and I can't physically do anything, my instant reaction is like, which isn't good because it was causing trauma to my mouth. And then gingival recession. So the recession was hence the receding gums line. And the receding gums that I noticed more was my bottom teeth. But the thing that sparked it, I noticed my top gums receding a lot in a short period of time. And that's why I was like, you need to pull your big girl pants on because your teeth are meant to last you. I mean, my nan, bless her, she was days off of her 80th. She had all of her own teeth. She was missing a few, but she still had all of her own. And my nan up north, she lost all of her teeth at, I think it was like 15, 16, through periodontal disease. And she's had dentures. So I'm like, in that middle, I'm like, am I keeping them? Am I not? I really would like to keep them. So we shall see. And it gives you like a full consultation report, which is what I liked, because for the money that you paid, as I say, the 175 for the consultation, for what I got, the photos, the x-rays, the report, I did think was actually a good review. Ow, just kicked myself on some of my little apparatus I'm going to show you in a minute. And that is what I'm going to have in a year's time. So at the moment, my work with the periodontal lady is done. Now it's just regular hygienist. And then at the end, we go back in a year and we see whether I need the laser treatment or any grafting, anything like that. So gingivitis is the early stage of gum disease, and it contains the bacteria, gingivitis is regularly known towards the front teeth. I think that might be because like you're eating more, like everything is there. Acted on gingivitis treatment can help prevent any further complications, which some of my areas did move on to periodontal. So the type of there's a different word here. Periodontitis is an inflammation of the supporting tissues, and it can result in loss of the bone. So that's what I was really worried at. So the top ones I noticed receded really quick in a short space of time. My lower ones I noticed receded, but like gradually over, I'd say, the good past couple of years. But it was, I didn't feel there was support, because I'm thinking, if that goes, your girl likes chewy meats and steaks and pork. I'm going to do a crackling, or I'm going to tear a bit of fat and I'm going to lose a tooth on it. So yeah, that was my that was my little worry. Sorry if my phone flashes, because I think Mum's going to ask me what I want for dinner soon. She's out and about, and I was like, you know what? I'm going to film a teeth journey, brush my teeth, and then have some food. They said that a big risk factor of periodontal disease was smoking, and I was like, I don't smoke. So mine, they feel, could be genetic, and it could just be a general build-up, and it could just be something that sparked, and here we are today. So I had a full report. So the treatment of my condition was to have the big... So the next part after the consultation was to go back in September, and that was to have the deep clean, but it was to be under anaesthetic, because for where the plaque was, they needed to like do things that you couldn't do if a normal person was awake. And when I tell you guys, even when I had the numbing, I still felt there was parts where she said, right, this is going to feel like I'm pulling your tooth out. I don't know what she was doing, but I genuinely felt like I wasn't going to have any teeth left. So I had like a 4-step program in essence, and it was the professional cleaning. Then I was on a course of like treatment, mouthwashes, creams, everything like that. And then I had my reassessment, which is what I went back to. And then we are on the corrective/surgical treatment, which at the moment I don't need. We're going to monitor it for the year, as I say, with the hygienist appointments, and then see if I do need it at the end. But it is now to do with like the maintenance of it. the gum recession could have been as well, partly through my fault. I'm a very aggressive toothbrusher. I'm not like someone who's like, she says to me, put it on your tooth for 45 seconds, let it do its thing and move. I'm like, like I am quite rough with my gums. Hence why they always used to bleed. If you've been with me a while, you know I would always suffer with bleeding gums. Touch wood, since I've had all this work done, my gums might bleed once a week, and that will be when I know when I've brushed too hard because my gums bleed, but on like a daily basis now, I don't get bleeding. If you remember in some of my vlogs, I would sometimes be talking or filming and I would feel all of a sudden my mouth just fill up with blood and my gums would just randomly start bleeding for no apparent reason. So whatever has happened has helped because I don't get that side of it anymore. The thing that I didn't understand was this occlusal trauma, and it says it's injury to the tooth surrounded by the occlusal forces which exceed the reparative capacity of the attachment apparatus. Now, in layman's terms, like how I understand it, the tissue injury occurs because the supporting tissues of the tooth are unable to cope with the increased stresses. So behind my two bottom front teeth, behind it, I don't have much gum left, and that is to do with my tongue piercing. So we're toying back and forth whether I need to take it out. The lady tells me yes, and I'm like, it's the only piercing that I've never had any problems with. And I'm like, I love my tongue piercing, like it's me. But if it's going to cause the fact that it's literally eroding my gum behind and I have nothing to support it, I might have to reconsider it. But that will be like down the line. She said once you've had a few hygienists, then you can speak with her and see how it goes, everything like that. So again, the concern, they also do like an examination finding. The main concern was the top gums have started to recede, bleeding gums a lot, and also my jaw clicks. When she was doing it, I'd done it and she was like, this jaw's clicking. She tested it all. I have no pain, but I don't know why my jaw clicks sometimes, and it's called a click of TMJ on the right hand side, but there's no pain. All of the soft tissues of my mouth were examined. Tongue, cheeks, roof, and the floor of mouth and lips. No pathology was detected. I think that is like a cancer check. Don't quote me on that, but I think like they do a full oral examination on you. Tongue piercing present, yes. I had a few teeth examined and there was mildly restored and partially erupted. Guys, I don't know the terminologies, okay? All I can remember was hearing like erosion, was it like not micellar, that's what, but there was all different words, okay, that was being said, and I was like, I have no idea what things mean. Mobility grading, occlusal wear, teeth mobility, anterior deep bite present, because I have a tooth here which kind of is a bit on the wonk, and it's always been like that. So I don't know if we're going to try maybe an Invisalign or straighten it out. But I, years and years ago, guys, looked into veneers, and I wanted composite veneers on my fangs because I didn't like my fangs. And Mum said, they're you. And I said it again to my partner the other month, and he said, your fangs are you? Like, why do you want to cover them up? And I was like, I don't know, because it's like, look, I have my fangs, and I'm just like, I don't like them. Sometimes I like them, sometimes I don't. But let me know down below, what do you think I should do about my fangs? Get them covered with a composite bonding veneer or leave them be? There's a thing that was tested, which was the pocket depths. And it said the pocket depths ranged from 4 to 6. Now, my scores were very high. My scores here are like 4s, 5s, 6, 6, 6, which meant like when she was putting the needles in, she could go right down, which I feel this is what is to do with the recession. Now, when I had this done, so that was a 6-page report. So you have your thing and that's your 6-page report. This is the report of what they give you for your teeth. So when Canon decides to focus, this is what you see. And you see this on a big screen up above. But all of these different lines is to do with recession, pocket depth, bleeding. Them red dots, guys, are bleeding. Can you see? Yep. Everything was bleeding pretty much. That's all I could hear, and all I could feel was my mouth filling up with blood. And I was just like, no, not a bit of me. So I had a full examination done. And then I had my x-rays and photos. As I say, I'll show you that at the end. I'll insert it because I think it's good to do a side by side. And also on this video, guys, we're not judging, okay? I would love to say I look after my teeth properly, which I do. I really, really do try and look after my teeth. However, there are some days where I will only brush them once a day. You know them days you come home, you're knackered, you end up just falling a kid, and you wake up and you're like, shoot, didn't do me nighttime brush. I always do a morning brush, but sometimes nighttime, we're all human. We get in, we might be a little bit worse for wear and we crash out, or sometimes we just can't be bothered to get out of the warm bed, to be perfectly honest. So after that, I then got my estimate. I was advised after that first initial treatment, like paracetamol, I was going to be sore. I was sore for about 3 or 4 days, and I don't know, it was just uncomfortable. However, I had all my radiographs done and everything that was like your baseline of it. We then went into the treatment plan. So my treatment plan included laser if I wanted it. It was just like a waiver to say that it had been described to me. However, at the moment, I didn't need lasers. I won't be needing or knowing if I need that until maybe a year down the line. So I was given, where's my estimate? Here we are. So I had a personalised treatment plan. So you get all of this, and as I say, you get copies of your x-rays, photos, everything like that. So it was a full mouth plaque disclosing with photos, oral hygiene instructions, a full mouth scale and polish. So this full mouth scale and polish was to do with my next appointment that I had in September. And it said, followed by laser assisted root surface debridement under local anaesthetics on the active pockets for all 4 quarters of the mouth under local anaesthetic to treat half the mouth on each appointment. Now, the lady that I went to only worked 1 Saturday per month. So I couldn't take time off of work to go for this dental procedure. So I ended up having my whole mouth done in 1 day. Hence probably how I had the reaction that I did, but we'll get into that for the next thing. And it says on there you'd need 2 appointments to complete the full mouth treatment, which, as I say, I had all on 1 day. And then 6 weeks later, you have your periodontal reassessment with your 6-point pocket chart. So again, I had all the needles, and I don't have a copy of that chart, but from the numbers that I was hearing, I was like 4s and 6s last time, quite a lot of 6s. My highest number was a 4 this time, and I had quite a few 1s and 2s. So whatever has happened is working. And as I say, the lady that, I will leave all of her details down below, she was the one that I researched into more periodontal, and if I needed the gum treatment, she was the only one that I could find that did the laser. A lot of them is to do with gum grafts, where they take a slice at the top of your mouth and then they'll fill it for your gum. I can't be dealing with stitches or anything in my mouth. The laser seems to be a very non-invasive way of doing it, and a lot of people can like go back to their normal eating, drinking habits that day. So I was like, if I do need that, this is the path I have to go down. So I go in. It also included my oral like top-ups, so mouthwashes, TPs, bits and bobs like that, which I'll show you in here. My first appointment was, as I say, you have a 20-minute hygienist, which is literally just going through, giving like a rough little clean up before you go in. Each side of your mouth, so each quarter, was £395. So each half of my mouth was £790. That, see, this I went to, I thought I'd go on my own. I did not want anyone with me when I was having this done, because I thought, I know what I'm going to be like. I don't like the dentist. I would work myself up. I just wanted to go on my own. Mum said that she would come. I said, don't, because Mum, you couldn't come down in the room with me. So Mum would just be waiting. And I was in there the first time, I think about an hour. And then I had to have an hour's rest. And then I was in for 45 minutes. It was sore. I'm not going to lie, guys. The injections, I don't do well with needles when it's not for myself. I weren't good with it at all. And when I had the first half done, I just remember sitting up and feeling in so much pain. I looked down, I saw the blood, And I was just like, luckily I didn't have a hypo. They was very good. I made them aware of my hypo thing. So before, I had a couple of sachets of sugar, and she said, like, at any point if you need to stop, we can stop. My partner actually come down and ended up meeting me at the dentist. So he was at work, I went down, and when I was coming out, I saw on my phone, like, I'm here. And I come up the stairs because obviously they couldn't do it all in one hit. I couldn't have a whole mouth anaesthetized, so I'd had half done. And when I tell you guys, it is the weirdest sensation not having function of your mouth. Like, I felt like I was dribbling. And as I say, when I saw, my face was quite swollen, a lot of blood, and I was just like, I can't. So I wore a mask back in like the sea days. And I come up, and what was all this? No, dinner time. I come up, and my partner was sitting there, and he was like, you all right? And I burst into tears. And he was like, okay, we'll go. He said to the lady, how long? She was like, she's got an hour of rest. Ta-da. When I tell you, I come out and I just felt, I don't know what it was. I don't know if it was seeing him. He thinks it was the shock of what had gone through and seeing like a familiar face. I was just like, ow. And I had the mask on, and he was like, it's fine. And I was like, it's not, because I'd had that sensation of the teeth being pulled out. And no offence, I genuinely thought I wasn't having any teeth. I thought they filed them down like, I'm going to need veneers after this. And we sat down once I composed myself, because I was a bit of a wreck, like walking down Abbey Road crying my eyes out. Once we found a bench and sat down, he was like, just pull the mask down. And he said, what side is it? I was like, this one, because this was the one that got done first. He pulled it down. There was a bit of blood, like my lips were caked in blood. He was like, open your mouth. And I didn't want to open my mouth. I was so scared for him to be like, there's no teeth there. And I was kind of like, you know, you're like, and he was like, open it. And I was like, I can't. So I opened it as best I could, and he was like, Shan, it's fine. And then when I licked my teeth, you know, when you just feel like all the smoothness has gone, it was just like chalk. I was like, they've ruined my teeth. He was like, they haven't. So I composed myself, had to then go back, had the other side, and then all of a sudden it was like, I was in that stage of having both sides numb, but then this side started to wear off, so I was gaining it back. And this, guys, it's just the most weirdest sensation. If you've ever had anaesthetic in your mouth for a dentist, it is just one of the weirdest sensations. I can't describe it. It's just, it's out of your control. And I was like, I don't know how I like this. But that was all done. Deep scaling done. I got given loads of stuff for my recovery. So one of the things I got given was Curacet. I actually had one which was 0.2, which was a stronger version, but I used all of that. And this is the one that I've had on my checkup. I will actually think I'll be keeping stuff like this because it's quite good for just your general checkups. I then got TPs, and now I can't lie, guys, I can't get on with the TPs. I'm trying and I'm trying, but I can't get on with them, so I need to persevere. I also had the Curacet gel. This I had to put on my gums of an evening, like slather it on and then let it sink in overnight. And these are actually really cool. These are little disclosing tablets. So they're purple little tablets, and you literally bite into them, and then you almost do it like a chewing gum, like you do it all around your thing, smile, and it will show you in purple the bits of plaque, or like where you need to focus on brushing. So I'm going to quickly change your battery because you're flashing, and then we can get into the bits of like my 6 to 8 week checkup for how I'm managing right about now, okay? Right, so we've had all the work done. Now it's healing time. I was sore for, again, 3-4 days. My teeth, I was living off of like soups and ice creams. I couldn't have anything like proper food, as you would say. So after that, my review, when I went back in 6 weeks, that was another £175. So my overall treatment plan was £1,850. Now that was done at my first consultation. I had to pay a deposit, I believe, of £350. And then when I went back for the treatment, I had to pay the remainder. I could have left it minus the 175, but I'd had a little bit of extra overtime, and I thought, you know what, I just want to clear it off. They did also offer 0% finance if it was something that people was looking for, but for me, I just wanted to know that it was done. I didn't want any more overhangs. I've finished my loan now, which I'm happy with myself. That was one of my resolutions. I've managed to finish my loan. I didn't want to then have to take another loan out, for example. So yeah, my overall teeth periodontal plan was 1,850, which is a hell of a lot of money. And I think if you'd have just put your big girl pants on before, would you need to have got to that? I don't know, but now I know I need to maintain it. So I went back, I had my review, and as I say, the mouthwash, I had a stronger one, but now I'm on a 0.05. This is great just for like daily use. I love it, like if I've had calf or snack man, oopsie, yes, I love a pastry or a pie. You know, pastry you can get everywhere. Give your mouth a little rinse with this and it'll get at everything that's like pretty much hidden. And yeah, guys, I don't know if anyone's got any tips on TPs, please let me know. I just can't. I read the instructions on the back, the lady showed me again, I was like, I just can't get to grips with it. I don't know why. And as I say, I like the plaque tablets. I think they're very, very good. They turn purple for old plaque and red shows new plaque. I feel like I'm going to sneeze. Hopefully not. But yeah, I had my review again. Me and my partner went down because we was actually having a weekend in London, which you guys would have seen. We was down for Disney. This bit of hair is really annoying me. You know when you just get that little bit, I'm like, I can see you. I can see you. Yeah, we was down for Disney. So I had to go to the dentist on the Saturday morning. Well, afternoon. And then we had like an evening up there. A messy evening in the Alchemist, let's just say that. And then Sunday we went to Disney, which you would have seen the little star vlog. Let me know what you think of them, guys, because he actually enjoys me filming when we're out, but obviously he doesn't get included. You might see the back of his head or the side or hear his voice. But yeah, let me know what you think of them style of vlogs. Do you think you want to see what we get up to, or do you just think don't bother? Because I think they would probably be like a reset style day vlog as to how I would do it, but let me know down below. So I went in, I had all the photographs done again. I had a update on, as I say, the mouthwash, how I was getting on, any pain, bleeding, anything else. And then I had to have the deep pocket testing again. She said to me, have your gums been bleeding? I said, not really. It wasn't as often, but as I could feel, I could hear muscle bleeding, muscle bleeding. I was like, I think that's normal when your gums are getting attacked by needles, like when they're literally being like prodded above, underneath, it's bound to happen. So I was like, you know what, it's not as bad. And like once I sat up and rinsed and that, the lady said there's still a little bit of a way to go, but it is a huge improvement from where we are. As I say, my numbers last time were 4 to 6, and now I was hitting like 1s and 2s, and my highest was 4. The 4 was still like my front teeth for the recession. So we wasn't doing too bad, okay? We was on the straight and narrow, let's just say, but it is a long process. So for now, I'm just getting my latest plan up, guys. My plan is I go back next month and I have a 1-hour deep clean hygienist. Then I have to have appointments every 3 months, only a half hour. And then in November again next year, I will have a review, a full periodontal review, where I'm gonna have to get a little needled up again, and photos, x-rays, everything like that, to see how it's sorted in the year, and then whether I do need to have laser surgery. So the hygienist timings are slightly different. Half hour currently is £150, but the 1 hour that I need to have next month is £250. So every 3 months I'm going to have to pay £150, so 50 quid a month to maintain my teeth. I have to think of it on smaller scales, because where I've been afraid of the dentist and haven't been going, I'm thinking, Jesus Christ, 150 quid? That's like a pair of Doc Martens. But I think £50 a month, 25 a fortnight, £12.50 a week. Like, I have to really break it down to minuscule things so Shannon's brain can just function and accept the cost of it. So when I went back, as I say, we had all of the photos, and after my year's review, we will then see, do I need to have the laser removal? Do I need to have like surgery? Do I need to have potentially the gum graft, which I don't, everything but the gum graft, I don't want that. It's just a long process. So I'm going to show you now, here we are with like some bits. So this is what I had on my very first thing. And for me to see teeth like this, just like it baffles me that you see it in this way. I mean, I don't think you can tell much from an x-ray, guys, but I mean, that's my teeth. That's my teeth. But I don't really know with the x-rays what I'm supposed to look at, to be honest. Obviously, the lady knows a lot more because it's to do with bone depth and pockets and everything like that. It's the photos. So, the photos, let's not judge here, okay? Because even when I looked at them, I was like, how could I not see that? But it's because she said we brush and we think we're getting to the top of the gums, but actually we're missing it. And clearly, I was missing a lot. So, this is the part that she's worried about with the gum recession in terms of with my tongue bar. So that was a before. So can you see here, this is where my tongue bar's like cutting into it. So this was before, so 6 weeks ago. And now we are looking like, please load, because the internet is not great in the bathroom. We all know that. It's not going to load now, is it? Come on, don't do this to me. And this is it now. So can you see, there is a big improvement. All the plaque has been removed, but it's still just a tad redder where the tongue bar is like hitting against it. So I'm like, okay. Now, the thing with this, guys, is when they put them clamps on, it brings up your nose, your nostrils, everything. It's not the greatest views. So I had like a clench done, and here you will see my gums are very red, very inflamed, very like veiny. But where she'd pushed the gum up, I didn't see what was underneath. So let's not, as I say, judge. This was the first stage of it. So this was how it needed to be for like the scaling. So you see there, this was after all my gums had been pushed up. There was plaque underneath the gums. So that was why I think I was experiencing the bleeding, because I couldn't see that underneath. However, now we are looking a lot better. It's going to take its time to thing. So this is now with all my gums pushed up. We're looking better. The only thing, I seem to have developed a tiny little gap here. But apart from that, it is tons better. For me, personally, I feel it's a lot better. And not just that, it's the colour of the gums. Like, my gums before was very red, very inflamed, very just like, you could tell they looked sore. And then we had a lower picture. Is there a, there we go. So the lower one, my gums, you will see the middle two, that the gums are like dipping. You see this here? Again, very red, very veiny. The gums are dipping. This is the one that the bottom have been receding, as I say, for a good couple of years now. So I was like, I kind of was aware of them. However, that still dips. You can't regrow gum. That's the thing. So the dips are still there. However, the colouring, I think, is the biggest improvement, because it's not as red. It's kind of like a normal colour. So for me, comparing those two pictures to how they were to now, I can see a massive difference. And obviously the deep scale polish and everything, it was worth the pain. And I think now, as long as I keep on top with the maintenance side of it, I shouldn't have to ever go through that again. As I say, the maintenance is the key part now. And I don't know why, I just had a really bad experience with the dentist with, again, it was, they was going to anaesthetise me, and then they thought no, so they thought they'd quickly try something, and it didn't. It's just put me off. Mama G has hated dentists ever since she was younger. She had a wisdom tooth removal. Oh my goodness. My wisdom tooth, that's sitting there. Sitting there. She said, do you want them removed? I was like, nope. Because I've had countless pain on and off with my wisdom tooth, and they haven't come through yet. So they're just sitting there. I'm just quite happy to leave them there chilling, to be honest. But it is going to be a long journey. So the stages of periodental, you can't reverse once it gets to that stage. While it's at gingivitis, you can kind of reverse it, or at least manage it. There were some parts, as I say, the two middle ones, there's nothing that can change for that. Those gums could well and truly still recede, but that's what the year's review will be for, to see like, is there any major more recession, or is it in line with a gradual recession, as I say, because she said gums do naturally recede. It just depends on the speed and the time of how long it takes. So I think I put my big girl pants on as much as I didn't want to, and it's the main part is done now. As I say, I never want to get back to that stage where I've got to have my face anaesthetised and be in that much agony. But yeah, it's just maintaining it now. And as I say, when I've been speaking to you guys, a lot of you have kind of been down the same road, or know someone who's been down the same road, and you wanted to like know a little bit more information. So I thought, you know what, I'll just do a sit down and I'll try and answer as many questions as I can. And if you have got any other questions, those, please do let me know down below, or drop me a message over on Instagram, or drop me an email, whatever works best for you. And as I say, I will try my best to get back to you and answer anything that I can. The prices, obviously, that I said are as of today. You may watch this in 5 years' time and the prices could be a hell of a lot different. So this is as of today in 2023. And God, 2023, eh? 2023, where is that time going? But yes, as I say, that is my periodontal gum disease journey, however you want to say it. But my teeth, still me blooming fangs. I think once all of this is sorted, I definitely want to look into maybe having them whitened a bit. You know what, just give them like a little bit more of a sparkle. But yes, sorry if this isn't the type of video that you wanted to click on, guys. But as I say, I have had quite a few of you ask me, so I thought, you know what, I'd just almost do like a sit down with Sham in the bathroom, keep him warm, and just do it all about my teeth, to be honest. But yes, guys, if you did enjoy the video, you know what to do. Hit that thumbs up and subscribe down below. And as I say, any questions at all, maybe you've been in the same situation, or you're noticing some different types of actions with your gums, let me know down below. As I say, I will leave the clinic that I went to down below. So if there's any problems or anything at all, you want to get a bit more information, just drop them an email. As I say, they're very responsive on the emails. And yeah, let me know how you get on. But take care, stay safe as always, and I shall see you in the next one. Bye, guys.